Hello and welcome to Dakota Wellness Chat. My name is Dr. Grace Kakari. I go by Dr. G, and I am with the University of North Dakota School of Medicine and Health Sciences. Please meet my co host.
Hi, I am Dr. Grayson Zhao, and I am with the North Dakota Department of Health and Human Services. And we are excited to have hopefully a great discussion with Dr. Craig Garfield about men's health and the North Dakota Fatherhood Survey. Dr. Craig, welcome to North Dakota, or as welcome as you can be virtually.
Yeah, good afternoon. It's good to be here.
Yeah, so why don't you tell us a little bit about yourself and your work, which I think is super significant around men's health and especially early childhood and the fatherhood experience.
Absolutely, yeah. So I'm a professor of pediatrics at Northwestern University and Lurie Children's Hospital in Chicago. And I've been studying fathers and the role that fathers play in their families for a couple decades now. And it really came from an interest of mine when I finished my training in pediatrics, where I stayed at home as a stay-at-home father for a year with my son. He was 18 months old at that point. And I got really interested as a practicing pediatrician to think about what do we do? How do we welcome fathers into their families when they've had a new baby, knowing that a lot of the focus is on mothers and the baby, which is very important. But dads also have been thinking about this baby and thinking about what it means for their life for the entire pregnancy and sometimes before that too. So I got very interested in studying the role of fathers, and a lot of our research has come out of that particular work.
Oh, wow. I had no idea that you were actually a stay-at-home dad. Very cool. Okay, so obviously this is a topic that we've known about for quite some time, but it obviously has not gained traction as fast as it could have. And so my first question would be, why dads and why now? What is the significance of starting a study like this in North Dakota at this specific time?
Yeah, I think that's a great place to start. We started thinking about the pregnancy risk assessment monitoring system for dads. So that's what the CDC has been doing for moms for 35 years, and it's called the PRAM study, Pregnancy Risk Assessment Monitoring System. And they had been doing it for 35 years, and it's where we get really good information across the country on things, for example, how many moms start prenatal care at the right time, how many moms get their flu vaccine, how many moms are exposed to secondhand smoke. We had really great information on moms. We had no information on dads. There were no questions for dads. There was no fathers included in the study. The only question they asked was one question, and moms started to write in on the surveys that were sent out in the margins. They used to write, "Why is the only question that you're asking about my partner is did he hit, kick, beat, or slap me during pregnancy?" And they continue to write, the only way I made it through this pregnancy was actually with the help and support of my partner. So the CDC approached us and said, gosh, how can we capture dads? How can we get information from this voice that had not been heard before? And we put together, we talked to a lot of dads, we talked to a lot of moms, we talked to a lot of professionals, public service groups and things to build a survey that we piloted in Georgia. And really what we've seen is that today's dads are different, right? We know more from the science that they play a key role in the health of the mother while she's pregnant and getting in to get her prenatal care. That if a dad's involved, the mom is more likely to have appropriate prenatal care. That around the birth of the baby, the mom gets better care if the dad is there. And things like breastfeeding and safe sleep, dads play a key role in that as well. We also know that dads are important in the development of the child, that the language that dads use is different than the language that moms use, and that helps the baby's brain grow. And that's a really good reason to be thinking about why dads. And finally, we've learned that dads themselves, for them, there's a big mind shift when they become a father, that they didn't used to think or worry about what was going to happen in the future. Some of them didn't even think they were going to live that long, so they didn't worry about it. But when they have a baby, they start to think about, I want to be there. And that's actually the phrase that we heard from the dads was, I want to be there. I want to be there when this baby enters kindergarten. I want to be there when this child graduates fifth grade and high school and goes to college. And so it's a shift in their mentality. And we see that in the behaviors that they have, trying to take better care of their health too. So that's part of the why. As for the why now, I think we can safely say that today's father is not your father's father. that this is a
Mhm.
different society that men are coming up in, and many of the men that we've come across, that I've come across as a doctor, really want to be involved, but they're not sure where to start or what to do. And there's this pull between also between work and not having a national family leave program that, or even a state's family leave program to support dads to be at home in the beginning taking care of their baby. So there's this tension between, I know I want to be there with this baby, I know I want to do it differently than my dad or my grandfather did it, but I'm not quite sure how to do that. So this survey, we hope, is helping us get the insight and the information and the data to help North Dakota dads to figure out how best to serve them across the state.
That is wonderful.
Mhm.
So these are not things we hear about a lot. We don't hear that they want to be there. We have our own ideas of who men are. And like you said, they are not our fathers or our fathers' fathers. But we need to know more to be able to be convinced. And this is one of the studies you co-authored talking about preemies that being more stressed than moms. And I mean, I think this will come out as a shock to many viewers. What did you really find out? And can you tell us a little bit more about the sample and then the major findings?
Yeah, sure. This is so interesting, and you're right, Dr. G. We don't often ask about dads or think
Yeah.
about dads, and when you
Mhm.
do, you actually discover some fascinating things. So this is actually the second of the studies that we've done. The first study we did was actually we measured salivary cortisol. So that's a hormone that you can actually measure in the spit of people, right? And we had
Mhm.
moms and dads in the NICU. So the NICU is the neonatal intensive care unit where
Mhm.
babies go when they're premature and they're not, and they're very vulnerable, they're medically vulnerable, and they're sick. Okay. So we wanted to see when you're getting ready to go home, and now you have to take care of your baby at home. It's a very stressful event, right? They've already made it through the NICU. Now they're getting ready to go home. So we had moms and dads both spit into a tube the day before they went home from the NICU, the day after they got home, 5 days later, and 14 days later. And we wanted to measure the cortisol levels, so the stress levels in those moms and dads when they were in the NICU, which should be lower stress. And then when they get home, we hypothesized would be higher levels of stress. And it was
Yeah.
fascinating because no one had ever done that. People had done it with moms, but not with dads. So when you do that with the moms, what we found is that the stress levels in moms was very high. The cortisol level in their saliva was high in the NICU. And when they went home, it remained high. What was so fascinating, though, is that dads had the same level as moms of height in the NICU. So they were very stressed by their saliva cortisol. And when
Mhm.
they went home, it actually went higher than moms. And what that told us is that for many dads, they may be kind of just keeping it together with the baby in the NICU and the mom in the NICU, and they're kind of, managing things. And then the baby comes home and it gets more stressful for them. They're trying to balance their work, they're trying to take care of their baby now, they're trying to support their partner, and they also don't have, and they try and take care of themselves. So that was one fascinating thing. The other thing that was fascinating, the finding of that study, was that we also asked moms and dads to record how stressed do you feel, not your saliva and your physiology of your body, but how are you feeling. Moms who were stressed recorded on the survey that they were stressed. Dads, when they were stressed, did not record that they were stressed on the survey, but their body was stressed. And what we thought was that what may be going on is that dads may not be in tune as much with the stress that they're feeling after having this baby and now getting ready to go home. And we followed that up a couple years later where we did another survey where we looked at from admission to the NICU all the way through to discharge.
Mhm.
Um, and that's the study that you were mentioning there, where we actually found that when moms come in, their depression levels on these surveys, again, are very high. Dads are a little bit lower. By the time
Mhm.
moms get out of the NICU, it could be a month or more later, they've kind of dropped almost in half, whereas dads have stayed completely the same. And what
Oh,
that tells us is that the moms are actually getting some attention and getting some improvement over that time period. And dads, we don't really do anything with. And they just, however they came into the NICU, that's how they're leaving the NICU. And it really was a call for understanding more about the importance of dads and how dads are transitioning into parenthood in order to really best take care of that new baby and that new family.
wonderful.
Wow. Those are some significant findings, especially when, you know, about, I want to say like about 10% of our babies are born premature, and, you know, a significant proportion of that do end up in the NICU. So it would be interesting to replicate some of that work around depression and mental health and behavioral health in North Dakota as well. Um, well, I guess one of the questions that I have, and I think you touched a bit on this, is, you know, when people think maternal and child health, or when they think, you know, early childhood, the initial thought is always like, you know, the moms. But now with, you know, 50% of the women in the workforce and things like that, we want to have a holistic discussion where we don't want the moms to feel left out as part of this conversation. And so, in your work, how can we encourage both parents to participate in the survey just as part of the design, and two, to sort of like understand that this is, you know, for the good of the whole?
Yeah, I think that's a really important point. Again, as a doctor and a pediatrician, I think what I love about pediatrics and taking care of children is that you can get everyone focused on the most important thing, which is the baby, right? Which is the child. And I think that that's an important perspective that we bring to North Dakota when we think about doing a survey like the North Dakota Fatherhood Survey, because we have information on moms, but we don't have information on dads. So at the very beginning, we have to acknowledge that we don't know what's happening to dads in North Dakota, right?
Yeah.
And so how do and at that really important time period of when the baby's coming along, right?
Yeah.
Because that's when we know, first of all, there's important behaviors around the baby, like making sure the baby's put on their back to sleep, so that, you know, the safe sleep environment. There's important behaviors around breastfeeding and supporting moms to breastfeed that baby, that remarkably dads play a huge role in that, in ensuring that moms start breastfeeding and continue and are supported in their breastfeeding. And then there's behaviors for the dad too, where dads don't often have a doctor. They haven't been to see a doctor. And yet now they're like, oh gosh, I have this new baby. How do what are my responsibilities? I want to be there when that baby's getting older, but you want to be there and you want to be healthy. So if you haven't seen a doctor, I think it's very important that you find a doctor. You figure out what your insurance is that will cover a doctor that you can go to, and you go see that doctor, because you don't want to go into the emergency room with, you know, your blood pressure and hypertension out the roof, and you're really sick, or you don't want to end up missing something that could, you know, a cancer, colon cancer, for example, that could be detected earlier, and now you're not able to be there and watch your child grow and help your family, help and support them. So I think part of it is understanding that we have a lot of different ways to collect information on moms, and this is just the beginning with the North Dakota Fatherhood Survey, to start understand what's happening with dads, because our research has shown that welcoming a baby into the world is a big call for change. It's a lever for change in dads and their behavior. So did you get your pertussis vaccine so that you don't give pertussis, which can kill babies, to your baby? Did you get your flu vaccine so you don't get your baby sick? Did you get your COVID vaccines? Like all these things that are important for dads to do to have their connection. Because guess what? Moms are connected with the healthcare system because they had a baby, right? So we focus a lot on that. The other thing to think about when you think about it holistically is the role that dads play in pregnancy-related complications. So those are the very unfortunate and very sad stories of moms who die after the birth of the baby. And our research has shown us that, who does mom turn to when she has a question like, I'm not feeling so good, it's hard for me to breathe? She turns to the dad, to the partner, to say, is this normal? And so if we don't include dads in that education, we're not doing that holistically. And so dad can be in a place to say, no, that's not normal. I read about that. I learned about that. I think you should call your doctor, or I think you should go to the emergency room. So I think that there's a lot more that we can do holistically, thinking about the dads. And at the same time, recognize that honestly, moms still do the lion's share of work. Like, I don't think we can discount that. They are going to be the ones that are breastfeeding. They're the ones that often have longer leave, so can spend time with the baby. And sometimes they are the gatekeeper to dad's involvement. And what I tell all the dads that I come in touch with is, find some time where you can learn to take care of your baby by yourself, without the mother looking over your shoulder, without the grandmother or the mother-in-law saying, don't do it that way, don't do it that way, but actually where you learn how to take care of your baby. What do you do when your baby's crying? A lot of mothers will start to breastfeed them. Dads, find another way. Find a way to gently rock them and hold them, talk to them, sing to them. And you only build that confidence the more time that you're there and involved in taking care of them. So I think getting back to your question about how do we do this holistically, I think
Mhm.
it starts from the very beginning when we walk into the room and we see a mom and a dad, that we don't just turn only to the mom and ask the mom the questions, but we actually pause and we turn to the dad and say, Dad, how's it going for you? How is it being a new father? Do you have any questions? Are there any worries that you have or any concerns you have? And so we can do that in the doctor's office, and we can do that in the programs that we all run and are aware of. We also are essentially doing that with the North Dakota Fatherhood Survey by saying, hey, we've got data on moms. Now let's hear for the first time from dads. So if you are a dad and you're listening to this podcast, I would encourage you to keep an eye in the mail for an envelope that's going to come that actually has the North Dakota Fatherhood Survey in it, because you are one of the lucky men in North Dakota that is being asked to tell us what it's like to be a dad in North Dakota. We need that information. You're the only one that can tell us that information. And based on that information, we can finally start to understand what's happening in families with mothers and fathers to better serve North Dakotans at the time of having a new baby.
That is wonderful. Thank you so
Yeah.
much for the pitch. And I can see Grace smiling. She's very, very happy right now.
I'm just like, we're gonna clip that bit and it's gonna be blasted through the entire student.
We'll make it huge. Thank you
You'll
so
be famous in the state of North Dakota.
much. Yeah, appreciate that a lot. I think you talking about some of these things we discussed, and Grace mentioned briefly depression, and I know just May was Mental Health Awareness Month, but I don't even think I came across any resources talking about men's mental health specifically. And then seeing this article that, of course, you're also part of this study, young dads at risk of depression too. I just want to hear more.
Yeah, yeah.
Mhm.
So many men and fathers will say, well, I had heard about postpartum depression or postnatal
Yeah,
depression in moms, but I never heard about it in dads. I didn't think I could get it. And I thought it was all related to the pregnancy and the birth and things like that. And it turns out about 10 to 15% of moms will have postpartum depression, and about half of that of dads will have postnatal depression too. And it's something that we are just now starting to understand a little bit more about. Um, some of it may be the change in roles and responsibilities that dads have at that time period. Some of it could be the changes um, in day-to-day life, where you're certainly, if anyone out there has kids knows, you're not sleeping as much. You have a lot of stress. It's trying to
yeah,
balance all these things that are going on. Again, we don't have a good family leave program, so dads are trying to kind of balance their responsibilities at work and also at home. So there's a lot of stress. And at the end of the day, we have a good number of dads, a significant number of dads who are suffering mentally from the stress of having a new baby. And they don't feel comfortable saying it to mom or even to their friends or family and things like that. Most men are really trying to just like be tough, man up, shoulder the burden, stiff upper lip, all that sort of things that go with being a man. Um, but in reality, it can be very hard for men. And men talk about they aren't able to bond with their baby, they aren't able to help their partner, they aren't able to take care of the daily life activities that they had enjoyed before. And we're starting now to get a better handle of what to do. And we now have people who specialize, just as people specialize in taking care of mothers in the postnatal period, to also specialize in taking care of dads. And some of the important reasons why we want to think about that for dad is because if dad is depressed, mom has a chance of being depressed. If both of them are depressed, that's really bad for the kid also, right? And that we also have learned that dads who are depressed are more likely to use physical punishment on their babies, which is not appropriate for a baby, and less likely to read to them, less likely to play with them. So all these things that we know help babies develop, dads who are depressed are not able to participate in. And what we found is that actually there's a pretty big shift after the birth of the baby for many dads. Some of it. It's not saying that everybody who's having these depressive symptoms needs medicine or therapy or treatment. For many dads, it's just someone to talk to understand, yeah, that's okay to go through. Many dads go through that, and have someone to talk to about it. who understands what you're going through. And so this being June and Men's Health Month, and also Father's Day, I would just encourage those of you who are listening to think about the men in your life who have had children, and to check in with them and say, how's it going? Something as simple as that. How's your stress level? Everyone has this in Hollywood and in the movies. It's all great having a baby, but any of us who have had children at home, it's really hard. It's really hard, especially in the beginning. So finding the support for mothers, finding the support for dads, is what's going to actually ultimately result in the best outcomes for children.
Wonderful.
Excellent. No, thank you. It just occurred to me when I had my daughter that we had an excellent pediatrician, and she did the postpartum depression screening up to a year postpartum, but never for the dads. It never, and to me that was the most innovative thing I'd seen at the time, thinking that the fact that she's following up up to a year, but nothing for the dads never even occurred to me. So that's an excellent point. All right, well, any parting thoughts? We are so grateful that you were able to join us and give us this excellent information, but what else can we learn about men's health? Where can we go from there?
Yeah, I think, to be honest, Dr. Grace, I think the most innovative thing that's happening right now is that North Dakota has decided, what, we want to know about men's health. We want to know about fathers in our state. So we want to get the North Dakota Fatherhood Survey out there. And there's right now 2 other states that are doing this, and North Dakota is going to be the third. So it will be the third state that actually has data that is actionable for men in your state. And I think that's super innovative, because otherwise, if we don't have data, then we're just dealing with stories, one story after another story after another. Sometimes those stories add up, and that's really important to listen to. But when you really want to make change, and you have to first understand the problem, you have to understand how to measure things. And I think with the North Dakota Fatherhood Survey, we have a way now to measure these with good survey data. And now we turn it back to the people and to the men of North Dakota to answer their surveys, and just let us know through the survey what your experience of becoming a father is. There are questions on there about your physical health, your mental health, your work. How do you feel about breastfeeding? How do you take care of your baby? Really important questions that are being asked because we want what's best for your baby. And I think if fathers can fill out those surveys and get them back, that's going to help the whole state understand how best to help one another. And we don't have that data now. So it really comes down to dads filling out their surveys. And Grace, you may remember what the incentives are. There's the incentive of just kind of providing the information, because no one else can tell us. I can't tell you what it's like to be a father in North Dakota. Only you can. So if you can give us that information, there's also some incentives for filling out this survey as well.
Yeah, you're absolutely right. If you do respond to the survey, we are sending out $20 in cash to our respondents.
Even better.
I like cash. Thank you so much, Dr. Garfield, for making time to be with us. We appreciate your time. We appreciate your insight. I think North Dakota loves you, and we want you back again and again and again. Dr. Grace, anything to add?
Oh, that is all. And I'm just super excited for this collaboration. I think something amazing is going to come out of it. And so thank you.
My pleasure. Thank you, guys. And it's lovely being in North Dakota today.
Right.
Enjoy the rest of your day.
Right. Bye-bye.